Good morning to one and all. Let me start with the greetings and best wishes for the conference. And ultimate, from the beginning with Professor Gurbachan Singh, starting with what we need in the times to come and where we stand right now. Wafa, then Belatic. Almost everyone was in the same tone that we have to work together to solve the problem what the whole world is facing. And on same line, I'm coming with one aspect, the theme of the conference, that is One Health, and the title of the conference is Agro-Vet. We, agriculture scientists, researchers, policymakers, as well as the counterpart, that the veterinary side, we all have to come together to solve the problem, upcoming problem of the food security, food safety, and the diseases what are emerging. Rightly said by Dr. Ganga, with the One Health, where we are right now. So Sweta, Gaurav, and the team, thank you very much for giving me the chance to stand before you all and going with some aspects what we are taking up at Indian Veterinary Research Institute, that is the deemed university, and that is the beginning of the animal sciences in India. And this institute where I'm coming from, it is 135 years old institute that was made to eradicate one of the disease, and it is no more in the world. So that is the success story behind this. It is a very high altitude institute that is situated nearly 8,000 feet from the sea level. This is a very common saying that our elders are always saying, that if we want to stand, we have to be united. And that is the sole motto of the One Health. If we will be the individual sectors, we started working like medical sector is working separately, veterinary and agriculture, then we are not going to solve any of the problems. So ultimately we have to come together, and this term One Health is now becoming viral. Every sector is discussing that where we can meet and to take up the challenge, forthcoming challenge. Sometimes people ask this question, that if the forests are burning, what I am losing? That is a big question. Sometimes it is being said by some of the people. So if we are not managing even the forest, what will happen? If you can see the count that 75% of the diseases, even you go to the SARS-CoV-2, that is the cause of COVID, or any other, everything is coming from the animals. What happened? See with the Amazon, that is the biggest firework that goes on, where millions of the species of animals are living. When they will lose the habitat where they are going to touch, they are going to touch the human population, the nearby core areas, ultimately mutually shifting the diseases also. So everything is interlinked, and we are calling interconnectedness is must right now. This is the genesis of my institute from where I am coming. Robert Koch, if some of microbiologists are here, he worked on this campus along with the Griffith and Pfeiffer. 3 Nobel laureates, they worked on this campus to eliminate one of the disease that we call as the cattle plague. It is the rinderpest. It is no more. It was eradicated, and the world is free from it. When it was declared, the history says that the disease work was started with the medical microbiologist, not the veterinary microbiologist or the veterinarian, but it was the medical side. They took over that disease, how we can control it. So the One Health started in India 135 years back. This is the first director of our institute, Alfred Lingard. He was the medical microbiologist. He served as a director of a veterinary institute for 17 continuous years, and a major person behind the eradication of the cattle plague disease. The right side, if you can say, is the famous picture of Robert Koch, Griffith, and Pfeiffer sitting in the campus of IVRI, Indian Veterinary Research Institute. We are free from the smallpox, and now the rinderpest is the one example, success story in the animal side. We are striving towards eradicating the FMD, foot and mouth disease. African horse sickness is also eliminated from many of the countries, and that is only through the collaborative work that has been done in the past, and we are proceeding forward. These are the major three problems the world is facing: food security, safety, antimicrobial resistance, and currently the emerging infectious diseases. Everyone is afraid of that. That is the CCHF, that is the Nipah, that is the West Nile, that is the Zika. Numbers are so many. This is the great challenge before the veterinarian, because directly that is being a human being interacting with the animal and getting so many infections from the animals, and some of them goes unnoticed even. So global livestock scenario, that is very important. If we go with the count only, you can see that 1 out of 5 person in the world is depending on the livestock for the income and its interaction. 40% of the total protein of the world that comes from the animals. So animal sectors become very essential to be focused right now. These are the demands. What we are predicting in times to come, they are going to increase because of the need of the food protein, animal protein. 200 times even some of the commodities will be needed from the animal side. So ultimately, to meet out, we have to go with the intensification of the animal husbandry. And whenever we think about the intensification, there are chances of interaction with the human population and exchange of the infectious pathogens. And this is the one side that you can see. We always have been hit by the bad pathogens, bad microbes from past till now. But if you can go with the last phase, last 20 years, they have seen majority of the emerging pandemics or the epidemics. And that has happened because of the certain things, that the factors are increasing, movement is increasing, intensification of agriculture or the livestock is increasing. These are some of the important diseases which have been noticed in India in past. This I was telling that these are the factors which are responsible for spread of the infectious pathogens from one part to other. Flyways used by our birds, they were neglected earlier, but now they are the concern. Then movement of the animals, livestock products, all carries the pathogens. These are the three strata which are exchanging from the wildlife that comes to the domestic to the humans, and all exchanges are very much possible, that we published in one of our book from the Springer in emerging transboundary animal viruses. So if you go with this slide, this is not to alarm anyone, but this is the, everything is increasing. List is not ending with these numbers. They are numerous. But if you go with the where we have achieved the success, it is very small. Only 3, 4, 5. You can count on numbers, but the number which is increasing, so this is the Pandora box. Whenever we start working, we get so many pathogens which are in the field, in the environment, in the soil. This is one species that is untouched. Even everyone must take care of it, the rodents. They are transmitting more than 53 infectious pathogens, and we are not aware even what they are going to cause. So ultimately, we have to go with the One Health collaborative and crosstalk between the sectors, between the institutions, between the different academic and the research collaborations are needed. And we have to keep we don't want to sacrifice the expertise, but we have to go with the convergence of everyone. What we are doing in India, that is the human health side, we are having several vertical disease control programs which are running in the country. They are managed by the government, autonomous bodies, national vector control, because everyone is talking about the climate change. The most impact that is going to come is on the vector-borne diseases. They are on very high rise, so there is one vector control program. Then we are having ad hoc programs that National Disease Control, that is the center in Delhi, they take care of the immediate outbreaks, they rush to that area and try to curb that. Recently, we are going with the integrated disease surveillance. This is the most important thing. Agriculture, veterinary, and medical, all we have to go with the integrated disease surveillance programs. This is for the animal health sector. It is well managed by All India coordinated projects. Then we are having different institutes which are specifically working on the epidemiology of the diseases of the animal side, particularly of the zoonotic nature. So we have the database of each and every disease right now maintained at Bangalore Nivedi Institute. Then we are having animal disease reporting system. Everything is digital. Whenever we are noticing any disease, that is incorporated and ultimately it reaches to our database. Wildlife is still a weaker section in the veterinary side. We are not having much data on the wildlife, what diseases are there and what they are going to cause. So ultimately our focus is increasing with the intervention of DSD, Government of India. Now we have started working with the wildlife also. Agriculture, environmental sector, we are working on the water quality monitoring because so many pathogens are leaching, ultimately going to the subsurface water. They are also cause of, again, in the irrigation system, they comes back and they can be harmful to everyone. Soil health, food safety, health, and the weather data, that all is now being integrated and in the main course of discussions for the One Health. Intersector collaboration that has extended in the last 10 years particularly, if you call. Then ICAR, ICMR joint programs are running, that is the Indian Council of Agriculture and Medical Research. Then SAARC countries also now awakened and they are working on the World Health concept, including Afghanistan, Sri Lanka, Nepal, Bhutan, and Bangladesh. Intersector collaboration already I have gone through. So this is the tree that we all have to follow. That is the tree of integration of the One Health, and our focuses are on the multi-sectoral collaboration, integrated disease surveillance. This is one of the organizations from where I am coming, Indian Council of Agricultural Research. In so many ways, it is working on different important pathogens of the humans like CCHF, Nipah, HPI, highly pathogenic avian influenza, swine flu, COVID, and different institutes of the ICR, they are working on that. This is the vaccine that was developed at where I am coming, the Mukteswar campus, ORF, that is the sheep disease, but it also affects the humans. We developed the vaccine and it is in the use of National Disease Control Program. Buffalo pox again comes from the teats, touching the teats by the milking, and that is again the vaccine developed at the IVRI campus, and this vaccine is in use in the field. Camel pox, very important in the camelidae family, and the vaccine was developed. This also affects the human. So several animal pox viruses, the vaccine has been developed by the IVRI Mukteswar campus. The veterinary side played a very important role to complete the definition of the One Health during the COVID period. These are some of the institutions, including the last of my institute where I served as the dean at Gadwasu Veterinary University. We tackled some human cases for screening of the COVID. This is the one lab. We screened nearly 62,000 samples at Mukteswar, Nainital, and nearly 6.5 lakh samples, 6,50,000 samples of the humans during the Gadwasu work. So we are having several key learnings from what has happened in the past, that we have to go with the intensive monitoring of the animal populations. They are needed to meet out the food demand, but simultaneously we have to work on the disease control monitoring. Wildlife markets, very much they are helping in the spread of the infections. Agricultural practices are very crucial. Then understanding how viruses spill over, they are changing the species. Bird flu was only limited to the birds, it reached to the humans, and now it is in nearly 7 to 8 species in the camel, in the cattle also, and several other species. We have to go with the conservation effort, better land use practices, sustainable agriculture. globalization and rapid viral spread, we have to go with the surveillance programs throughout the world and integration of the data from where the diseases are moving. Role of the intermediate host, we don't have. Still, we don't have any clue for the COVID. Think about that is the very latest, and we have all technologies, so we have to work on these areas. Diagnostics and vaccines, we are working on it. So this is the one big program that Government of India has launched, that National One Health Mission. It is having nearly 11 ministries in the country. They are integrated now to solve the problem of the diseases what spreads from the humans to animals or the animals to humans. So this is the future, that if we think that the virome, the latest technologies which are coming, tools and technologies, metagenomics, that shows that there are several viruses which are lying in unnoticed species like bats, rodents, rats. This is one saying by Zhengli Shi. She is called as the bat woman of China. She has worked more than 2 decades on the bat viruses, and I was fortunate to work before the COVID in the same lab. The Wuhan Virology Institute, I worked with Zhengli Shi working on the bat coronaviruses before the COVID outbreaks occurred. What she says, this is the only beginning. There are several viruses which are in pipeline. They will come from the bats. We must be prepared to tackle all those. So need of the hour is we have to develop the consensus among different stakeholders. We have to go with the collaborations, cooperation, coordination, and ultimately the commitment, what I am seeing from the UAE government officials. Like that only, we need the committed people to come forward, help in the financial status, ultimately to curb those all emerging infectious diseases. So I would like, in the last, like to thank my council from where I am, Director IVRI, for giving me the permission to come here, my last institute, Gadwasu Ludhiana Veterinary University, my research colleagues who worked with me, project staff, PG student, field staff, and laboratory staff. No word is for the ARCC. Gaurav, Sweta, consistently since last 3 months, we are in discussion working on how to organize this event. I am thankful to each and everyone for listening me. And if you have any query, I'm here to answer if I have the answer. Thank you very much.